Hi, this is Elisabeth from Genexia Health. I hope you guys are doing well. I wanted to talk to you guys about pap tests. So this video is mostly dedicated to the women, but of course, if you are a man and you have a woman in your life, then maybe you should listen too. So one of the things that's really interesting about pap tests is that there are all kinds of advancements in pap tests that a lot of the population don't know anything about. One of the things is we used to do pap tests regularly every year, every 2 years. And what they would do is they would take a few cells from around your cervix and then they would put it on a slide and see if those cells were abnormal. If you have abnormal cells, at that point, then you would have an intervention done by the doctor just to make sure that the cells are actually abnormal and cancerous. And if they were, they would be treated in the appropriate manner. There are other reasons why cells can be abnormal. It can be if you had an infection in there recently, any trauma in there recently, can also cause your cells to be slightly abnormal, but completely benign. There's no issue with them. What we've realized though is that if we do an HPV test, that gives us more insight as to what exactly is happening inside of your body as a woman. So the realization that HPV is responsible for cervical cancers, we realize that if we test you for HPV via a pap test, it's something that we only have to do every 5 years, because if the HPV is positive, we manage the HPV and we pray that it never turns into abnormal cells, and we monitor you closely. If the HPV is negative, on that pretense, we think to ourselves, well, that's okay. If you don't have any abnormal cells, then there's no reason why we have to do anything too crazy right away. But the exciting thing is that means that you only really have to do a pap test once every 5 years. So how does it work to do pap tests at your home is another question that we get asked quite often. So we have most of the women that do their pap tests with us, they actually answer their door in their house coat or still in their PJs. We would ask that you pee right before the nurse gets there and that you set up 2 dining room chairs in your bedroom. We would scoot you right down to the foot of your bed. We put the chairs at the bottom of your bed so you have your feet. Our nurse comes with a special little stool. She's able to do your pap test and then she does an internal exam at the same time. We would send you a questionnaire that you would be able to fill out just to make sure that you meet the criteria to have the testing done at home. And our tests are usually resulted within 5 to 10 days. By 10 days, you're going to for sure have the results, but usually we're getting them quite a bit sooner than those 10-day markers. You will receive the report and your doctor will also receive the report. If you don't have a doctor that can give you the referral to do the pap test, our nurse practitioner can follow up with you and they would actually see you after the pap test results are in to discuss your further management. If there's something abnormal, if there's any issues with your pap test, or we only have to see you again in 5 years. And then once the pap test is complete, women jump up and go into the shower and everything is done. We can also offer you HPV vaccines at home, which I do highly recommend because that is a really good protection against cervical cancer, being that HPV does cause cervical cancer. Not always, but it does cause cervical cancer. And so we can even arrange to have the HPV vaccine given to you at the same time as we do your pap test. So these are to answer some of your questions in a nutshell. If this is something that you find interesting, definitely reach out to us at Genexia Health. We'd be happy to help you out, or talk to your doctor. Of course, if you don't want to go the private route, that's okay too. But definitely talk to your doctor about your health and ask them, do they do the traditional pap test or are they doing HPV testing at this point? If it were me, I would be going with the HPV test 10 times out of 10. So I hope this answers some of your questions and I wish you a great week. Take care.